How to self-diagnose and solve 80% of your headaches. In this video, I'll give you a link to the self-diagnosis flowchart and show you how to find the cause and in many cases, fix the cause of your headaches. If it's stress, muscle, or eye strain induced. For the headaches caused by nutritional issues, check out my last video where I give many nutritional specifics for you to get rid of your headaches. Recall that there are 7 synergistic steps to get rid of your headache. I've spent a lot of education and effort on mastering steps 1 through 5. Practically speaking though, steps 5 and 6 are where I get most of the results most quickly. This is restoring body neurology and structure and moving and using your body correctly. Today we cover how you know what to do if it's not entirely nutritional. So step 5, restoring body neurology and structure, involves muscle work, spinal adjustments, and neurological exercises. Spinal adjustments restore joint motion, muscle tone, and nerve activity. Muscle work, like myofascial release and trigger point therapy, remove toxic buildup, and improve blood flow. And neurological exercises help correct specific deficiencies in the nervous system. Step 5 is how most headaches are resolved. But for long-term results, step 6 is critical for most people. And some people can resolve their headaches without step 5 if they do step 6 very well. Before we get to resolving the problem, I'd like you to be able to determine what the problem likely is. Of course, this is the job of the doctor, right? Yes. Unfortunately, most doctors are not taught how to diagnose the cause of neuromuscular conditions. This includes neuromuscular pain like headaches. Many of them will just try to break the pain cycle by medicating it, and hopefully your body will correct itself after that. Sometimes that works well. Now, don't miss the point. Not all headaches have neuromuscular and nutritional causes, so please let your doctor determine if there's something that truly needs drugs or surgery. If they can't find anything, that's good news. What, you say? Yes, that means you almost certainly can be corrected through these 6 to 7 steps. So, maybe and hopefully you can do this on your own. So let's get with finding that cause. First we ask, where is the pain located? Most people's first thought is, well, in my head. Yes, but where exactly in your head? So let's start with the left side of this flowchart. In the temporal area or the entire head. So temporal area or the entire head. The next question we ask is, are certain muscles tender? So let's find out with certainty if certain muscles are tender. In this case, the upper trapezius insertion, the suboccipital, temporalis, or masseter. And these 4 spots, top of the shoulder, where the 2 bones meet, at the base of the skull, the side of your head, and the side of your jaw. Use pressure that it would take to, say, squish a piece of molding clay, maybe 1 to 2 pounds. If it changes your headache, making it better or worse, this is the source of your headache, or at least a source of your headache. It may not be the only one, but it is one of them. And you need to follow the yes to do much of the work. So follow that flow chart. Yes, those muscles are tender. And then you want to do that muscle work, like trigger point therapy or massage. Correct related joint dysfunction and stress that may be causing these toxins to build up. If pressing into all those muscles, none of them change your headache, then we follow the narrow arrow to address the food sensitivity, other nutritional issues, or medication or caffeine rebound syndrome that is likely causing your headache. If your head pain is in the suboccipital or neck area, follow the question and directions to your answer in this center path. Ultimately, this leads you to muscle toxicity and joint dysfunction. The solutions would start with trigger point therapy, massage, and postural and/or emotional stress reactions, and might need to progress to professional help with spinal adjustments and other therapies. Finally, on the far right, the orbital pain path may be due to sinus congestion, vision, muscle toxicity, or nutritional medication issues. So if you have pain around your eyes, those are the things you want to consider. If it's sinus congestion, I recommend you consider using the nasal rinse and a facial lymphatic drainage technique. For farsighted vision problems, I recommend the Bates method. I'll give you a link to the book and CD series walking you through it. If you're nearsighted, myopia, if that's your issue, you might also look at a website called endmyopia.org. If it's muscle toxicity, I'll discuss that more in the next 1 or 2 videos. If it's nutritional or medication caffeine issues, look back at my first 2 videos on this topic. I'll give you a link to the flowchart in the video descriptions below. So I hope this series on headaches has been helpful for you. The next episode will cover headache solutions for desk workers and students, talking about posture and exercise. There's a lot of information in the links below, so please check those out. And I hope you have a wonderful day. May God bless you.